Walking along Crescent Shore toward her night shift at 7:30 p.m., Nurse Lauren Mitchell paused abruptly when she heard frantic cries. The voices of children echoed from the sea, laced with terror and desperation. Rushing to the water's edge, she spotted two small figures battling the waves. 6-year-old Mia and 9-year-old Ethan were trapped in a relentless rip current. Bystanders on the beach shouted in panic, some dialing emergency services. But Lauren acted differently. She shed her nurse's scrubs and plunged into the icy waves without a second thought. These sounds of distress and life-or-death crises were not unfamiliar to her. Her hands moved with precision, her mind already mapping out a tactical rescue. In the next 15 minutes, everyone on the beach would discover who Lauren Mitchell truly was, because some wear a nurse's uniform but never remain on the sidelines. Welcome to Hidden Heroes. Before we dive into this gripping tale, drop a comment with the city you're reading from today and don't forget to like and follow for more stories of unsung valor. Lauren Mitchell was the backbone of Bayside Regional Hospital's night shift. At 32, she had served at the hospital for 4 years, her record impeccable. She navigated every shift without issue, maintained flawless patient charts, and faced challenges without complaint. Her colleagues drew strength from her steady presence. Lauren kept her cool in high-pressure moments, resolved complex issues with ease, and always had critical equipment prepared. With her dark blonde hair neatly tied back and her hazel eyes scanning every detail, Lauren instilled confidence in her patients. Her calm voice soothed their fears, and her steady hands brought them comfort. Lauren's approach to equipment management set her apart from her peers. She inspected every item with the precision of a soldier, checking medical supplies, instruments, and communication tools as if preparing for a critical mission. Her colleagues sometimes teased her about this meticulousness. "We're nurses, Lauren, not commandos," they'd say with a laugh. Lauren would offer a quiet smile, knowing they didn't fully understand. Her ability to handle emergencies left even her supervisors in awe. "Where did you learn to take charge like that?" they'd ask. "Experience," Lauren would reply, always keeping the details to herself. Her skills, however, were forged in a world far beyond the hospital walls. At 19, Lauren had enlisted in the Navy, joining the elite Hospital Corpsman program. After rigorous basic training, she was handpicked for advanced courses. The U.S. Navy's Hospital Corpsman training was among the most demanding medical programs in the world, but for Lauren, it was only the beginning. She was selected for the Special Operations Combat Medic course, a grueling 18-month program that trained her in life-saving techniques under extreme conditions, naval operations, underwater emergencies, and medical interventions with minimal resources. Lauren graduated in the top 2% of her class, skills that would prove vital on Crescent Shore that day. A Navy corpsman isn't just a medic, her training commander, Chief Petty Officer Vargas, had told her. "You're the one making life-or-death calls in any environment. Whether underwater or under enemy fire, you'll keep drowning victims alive." Lauren had embraced this mentality, delivering maximum medical impact in any conditions, performing surgical interventions during naval operations, blending water rescues with immediate care, and battling technical limitations were her core principles. The toughest part of her training was underwater rescue medicine, emergency interventions during dives, treating cold water hypothermia, rescuing the injured at sea, and conducting medical procedures with only basic supplies. Lauren had honed extraordinary skills in these domains. On her first deployment, she supported carrier-based medical operations in the Pacific, handling medical duties on Navy vessels, helicopter crash recoveries, sea rescues, and providing critical support. Her most pivotal moment came when she saved a pilot who had plummeted into the ocean during a storm. Amid freezing waters and towering waves, she executed hypothermia and drowning treatments using just rudimentary medical gear. On her second deployment, she joined the Coastal Operations Medical Support Team in the Persian Gulf, offering aid during amphibious landings, backing underwater demolition squads, and performing emergency interventions in shore-based ops. The techniques she mastered here were worlds apart from civilian medicine, particularly her methods for managing multiple drownings and water rescue protocols with scarce equipment. Lauren had trained herself to operate in every kind of maritime chaos: cold waters, surging waves, zero visibility. Nothing could halt her interventions. Her instincts had evolved into an aquatic medical compass, abilities that would rescue lives on the beach that fateful day. Her third assignment involved peacekeeping in the Mediterranean, rescuing refugee boats, delivering aid to civilians adrift at sea, and leading humanitarian water rescue efforts. Lauren had now achieved expert-level mastery in all sea and coastal medical scenarios. But above all, she never let any ocean condition stand in the way of her care. Over 9 years, she had executed 67 high-stakes water rescue medical operations without a single one compromised by the elements. So why had she left the Navy for nursing? The story was far more layered. PTSD, reintegration struggles, the harsh realities of civilian life. Lauren's shift hadn't been seamless. The high-stakes medical world felt comforting, but civilian protocols clashed with her ingrained habits, a tension that would erupt that day. After her honorable discharge in 2020, Lauren entered the civilian healthcare field. She leaned on PTSD therapy, reintegration programs, coaching, and career transition resources. Hospital nursing proved an ideal fit. It reignited the passion that drew her to the corpsman role, aiding those in peril. The hospital's steady, foreseeable, uplifting atmosphere was a balm after years of naval intensity. Peace settled in with quiet joy. When Bayside Regional Hospital brought her on board, Lauren was vastly overqualified: a nursing degree, 9 years of military medical service, corpsman certification. Yet the hiring committee skipped the deep dive into her past. They were thrilled to snag such a strong applicant. "I've always loved pulling people from the sea," Lauren had shared. And this time, she meant it utterly. Day-to-day tasks were a breeze compared to deployments: patient monitoring, standard protocols, routine alerts. But Lauren went further. She viewed every case through a corpsman's lens, preempting potential aquatic emergencies, forecasting how child-related crises might unfold. "Lauren, how do you know so much about water hazards?" her colleague Sarah would ask. "I grew up on the coast," Lauren would reply. "Every water incident teaches you something." This wisdom stemmed from 9 years of naval ops. That Tuesday evening, Lauren stuck to her pre-shift routine. Strolling Crescent Shore had become her ritual. Her night shift kicked off at 8 p.m. As she walked the sand, faint children's screams carried on the wind. At first, she dismissed it as typical beach clamor, but the tones were off. Raw panic, sheer terror, utter desperation. "Help! Our kids! They're drowning!" Lauren bolted toward the cries. A family on the shore was yelling in vain: mother, father, and siblings. Roughly 40 meters out, 2 children thrashed against the surf. Lauren sized it up. 2 kids, vicious current, no beach rescue gear, Coast Guard ETA at least 15 minutes. "Call 911. Get the Coast Guard." Lauren barked at the family. 2 children drowning in the offshore current. Lauren ditched her scrubs and charged into the sea. These water rescue crises were her old territory. When she first reached Ethan, things were dire. The 9-year-old was desperately clutching Mia, but both were going under. Ethan's grip was slipping. Mia was completely unconscious. "Ethan, I'm a nurse. I'm going to help you and Mia," Lauren said, her voice steady but firm, trying to calm the panicked boy. His body temperature was dropping, his movements sluggish. "Mia's not breathing," Ethan cried. "She's not moving." Lauren quickly assessed Ethan. He was in shock but alive. Mia's condition was far graver: no chest movement, lips turning blue. Lauren applied a water stabilization maneuver from her Navy Corpsman training, lifting Ethan's chin to open his airway and delivering short, forceful breaths. "Ethan, take deep breaths. I'm here." "You're safe," she said with calm authority. Ethan stabilized after a few seconds, his breathing steadying, his eyes clearing. "What happened to Mia?" he asked, voice trembling. "I'm going to save Mia." "Hold onto my shoulder and swim," Lauren instructed, placing Ethan's hand on her shoulder. She maneuvered Mia into a rescue position, a technique drawn not from civilian lifeguard training but from elite Navy Corpsman underwater rescue protocols. Lauren swam swiftly toward shore with Ethan clinging to her. He was a strong swimmer and, now recovered, helped by holding on. "Ethan, you're doing great." "The shore's close," Lauren said, her tone encouraging. Simultaneously, she monitored Mia's condition. The girl's pulse was faint, her breathing absent, her body temperature plummeting. While swimming, Lauren executed a complex rescue, holding Mia in a medical transport position with one arm, swimming with the other, and guiding Ethan. "Is Mia sleeping?" Ethan asked, his voice laced with worry. "Mia's very sick, Ethan," Lauren replied. "But I'm going to save her," she promised firmly. As they neared the shore, Mia's condition worsened, lips darkening to deep blue, body temperature critically low. Immediate intervention was critical. Upon reaching the sand, Lauren placed Mia in an emergency recovery position. Ethan was safe, exhausted but stable. Mia needed urgent care. "Someone call 911. Lauren shouted to the family, her voice commanding. "Pediatric drowning victim. Severe hypothermia. Advanced life support needed now." Lauren assessed Mia: severe hypothermia, significant water aspiration, cardiac instability, and a risk of neurological complications. With no ambulance yet, she began CPR, not standard CPR, but a specialized pediatric cold water drowning resuscitation. Her chest compressions were precisely calibrated for a 6-year-old's physiology, her rescue breaths adjusted for potential lung damage, and her cardiac monitoring tailored for hypothermic patients. This expertise stemmed from her advanced military training. Mia's condition was dire. Water aspiration had compromised her respiratory system. Lauren applied Navy Corpsman techniques, underwater medical rescue protocols, hypothermic resuscitation, and pediatric advanced life support. The crowd watched, awestruck, as she performed professional-grade naval rescue medicine. Ethan's father, Daniel, approached in a panic. "Will she be okay?" Lauren, still administering CPR, looked up. "Sir, Mia's suffering severe hypothermia and water aspiration. I'm providing advanced life support. She's fighting, and I won't let her go." "Ma'am, this looks like elite medical work. Where did you learn this?" Daniel asked. Lauren paused briefly, checking Mia's pulse. "After 4 years of shielding her past, she let slip, I have special training." For 12 minutes, Lauren sustained resuscitation, advanced cardiac life support, military-grade protocols, and life-saving techniques honed as a corpsman. Ethan's mother, Clara, watched helplessly. 12 minutes is too long," Clara murmured, trailing off. "No," Lauren said with steely resolve. "I won't lose Mia." Her Navy training had drilled into her: never abandon maximum effort until every resource is exhausted. In the 13th minute, Mia's heart flickered back to life. She coughed, her eyes fluttering open. "Oh my God," Daniel gasped. "How did you do that?" Paramedics arrived 8 minutes later. "Advanced life support ambulance, pediatric equipment," Lauren reported. 6-year-old female, unconscious, hypothermic, compromised airway. "I've maintained airway patency, provided rescue breathing, monitored vitals. Current status, conscious, stable breathing, warming. 9-year-old male, conscious, mild hypothermia, emotional trauma. The paramedics exchanged stunned glances. The report was textbook professional. "Ma'am, what's your medical background?" the lead paramedic asked. "Registered nurse," Lauren replied. "Your assessment is remarkably thorough." "Special training?" Lauren hesitated. "Military medical." "Which branch?" "Navy Corpsman." The paramedic paused, eyeing her with respect. "How long?" 12 years. 3 deployments. Special operations. Water rescue medical support. The paramedic nodded. "That explains it. Your patient care was flawless." At Bayside Regional Hospital's emergency department, Dr. Emily, the attending physician, reviewed the cases. "Who provided initial treatment for these pediatric drowning victims?" "Beach rescue by a civilian nurse with a military background," the paramedic reported. Dr. Emily studied the charts and froze. "This is extraordinary: advanced pediatric resuscitation, hypothermia management, complex airway procedures. This is combat medic level care." Lauren sat quietly in the waiting room, but Dr. Emily's next question would unravel everything. "Which medical professional did this?" The paramedic pointed to Lauren. "She did, ma'am. Specialized water rescue medicine." "Where did you train?" Dr. Emily asked. Lauren took a deep breath. U.S. Navy Special Operations Hospital Corpsman Program, underwater medical specialist, 9 years active duty. Silence fell. Everything clicked into place. Dr. Emily was floored. "Our nurse is a retired Special Operations Corpsman. Not just any corpsman, advanced water rescue medicine, pediatric drowning response, multi-casualty marine incidents." Sarah and Daniel, nearby, were piecing it together, but Dr. Emily's next question brought clarity. "What was your military rank?" "Petty Officer First Class, Combat Medical Specialist," Lauren answered. Even Dr. Emily was impressed. "Petty Officer, your water rescue expertise outstrips most of our emergency staff." Lauren remained humble. "Different context, Doctor. I'm a nurse now." But Dr. Emily's next offer would shift her path. "Petty Officer Mitchell, would you consider joining our pediatric emergency department?" Lauren blinked, caught off guard. "I'm not civilian pediatric emergency certified." "We can arrange that. Your skills, your experience, we need them." Mia and Ethan's family approached Lauren. "Petty Officer Mitchell," Daniel said, "we can't thank you enough." Mia's fully recovered. "I just did my job," Lauren replied softly. "You mentioned Navy Corpsman," Daniel pressed. "Can you tell us more?" Lauren shifted, uneasy with the spotlight. "I served 9 years as a medical specialist, Afghanistan, Persian Gulf, Mediterranean. Specialized in water rescue operations." Daniel was stunned. "You're saying our children's savior is a retired Navy Special Operations medic?" "I'm saying I'm trained to handle water emergencies," Lauren said. "That's what counts." "So now we ask you, have you ever met someone like Lauren? A healthcare worker whose military past you never suspected? Someone you saw only as a compassionate caregiver? Drop their name in the comments and share their story. Because here at Hidden Heroes, we believe the fiercest protectors often serve in the gentlest roles. If this story moved you, share it, follow, and help these vital stories live on. See you in the next hero's tale. Until then, remember, your healthcare provider might have saved more lives than you'll ever know. Service takes many forms, sometimes combat gear, sometimes hospital scrubs. True heroes never stop serving.